Assalamu alaikum. Good morning, everyone, from my side. My name is Mohammed Mutawakkil. I'm marketing manager from Draeger Medical. And I would like first to thank Dr. Huda and the whole Anaesthesia Committee of Kuwait to give us this opportunity to bring you some and talk about some innovation from Draeger Medical. I would like to thank you all to be here and to take some time to listen to us. And last but not least, I would like to thank Dr. Ziad and all his team from Central Circle who are supporting you here in Kuwait with our Draeger solution and supporting us as well because we are a German-based company. I would like to talk about one of the innovation we developed already some years ago, SmartPilot View. Some people call it, is it a GPS for anesthetists? And I will first give the background of the development before going to the product itself, biosimulation. Okay, actually one of the background, as you know better than me, you are doctor, physician, I'm not doctor, you are the expert. That the first thing, the main component of any cases or any in ICU or in OR, it's the patient, of course, the physician and the treatment and in between the decision making. But we also know more and more that the data and the information are increasing dramatically since years now, and the need to reduce cost and saving costs is a hot topic in any facilities, anywhere, every hospital, and need to improve quality of care. And last but not least, as we know, the staff headcount everywhere, all over the world, it's getting very difficult. The other thing, and it's one of the major background behind SmartPilot View, you know these slides better than I, the sedation, the relaxation with the QRR, and the analgesia with all these opioid. And the main challenge, as Dr. Rick from Belgium are telling, models are all able to calculate effect size of each drug individually, but the problem, you are using different drug, and the major thing is the drug interaction between the two drugs. Sometimes 1 + 1 might equal 20, and sometimes 1 + 1 might equal 0.5. This is one of the background of the SmartPilot View. This is a study that was done, some years ago, that the data are dramatically increasing, exponentially increasing in any OR, any ICU. The information as well, the knowledge is how it is for today, and the facilities utility are growing but very slowly over the world. And the idea behind the SmartPilot View, why don't we take this data, put them into the information, and even better, to put them to cognitive information. But maybe some of you would ask, what does it mean, cognitive information? I will give you one slide, you will understand exactly what is behind. Mind the curve, if you have this notice, it's very easy to understand, and if you have this icon as well, they match together. It's very easy. The gap between understanding the first one or the second one, it's very easy. But when you have such information and such notice, to digest this, it's very difficult actually, and you see how much word we have to read. If you have this icon, it gives you exactly the same information than the notice on the left side, and this is what we call cognitive information because our brain is built up like this. And as I told you, the most important thing is the drug interaction between the drugs when you are pushing the drugs inside the body of the patient. How to know this drug? Actually, there are plenty of studies since 20 years now in the field. They are difficult to read actually. From Minto, from Schneider, all these models are existing today. And there is some missing one that was developed the recent year by Professor Bouillon and others from Switzerland. And actually this is how it looks like, very difficult actually to interpret. This is the mathematical models between the interaction between, for example, here the sevoflurane and the remifentanine, and the probability to not respond on the left side. And actually when we take these figures, it's very easy actually, you have some lines. Here it's equal the Mach 95 actually, you have the Mach 50 here, and you have the Mach awake here on the drug interaction. And what we did in SmartPilot View, we just look at the graph from the top. We took this picture from the top, we put it in a 2-dimension that will be easy to follow up, and then it's exactly the SmartPilot View screen. The 2-dimensional interaction drug between hypnotic and opioid on the axis. And actually how it looks like on the screen, the SmartPilot View, you have the left side when you have this really innovation of the SmartPilot View, the two interaction display. We added a time-based timeline in order to follow up the anesthesia, and you have 40 minutes before and 20 minutes after to do some prediction. It's one of the aim of the SmartPilot View. And of course, we will add time-based all the drug you are using, like sevoflurane for here, propofol if you go for propofol afterward, and of course the opioid you are using like remifentanil. And we add as well the NSRI, the neurostimulus rate index, as it's like a kind of beast that it shows you how deep is the anesthesia. And we add two more things for the people who are interested to have the QRAR effect and to see where is the peak. And the hemodynamic from the monitor. We don't take into account the QRAR and the hemodynamic. They are not part of the models on the calculation, how deep is the anesthesia of the patient, but they will be here on the screen to have in one shot everything related to the patient. And of course you have, this is the screen. Now I will show you how it works on the real life actually, because all this background, it's like a GPS. There is a lot of calculation behind, but the only thing we need is I want to go from A to Z, and the GPS has to give me this information. I don't need all this. If you forget all this background, it doesn't matter, because this is behind. And
5 minutes.
Sorry?
5 minutes.
How it looks like actually. The screen is here when you start the simulation. It's a simulator actually. And you have to put the data, demographic data from the patient. Of course, if you have it already done in the anesthesia machine, they will come automatically on the system. Then we have just to validate. And then I will add one drug here because I don't have any vaporizer. I have to add something. And you see the screen here, the two-dimensional screen here, and you see all the drugs here. For example, I will add some sevoflurane, whatever I need. And you see on the left side, I don't see it here because it's behind. I will show you something just after. I will add some remifentanil, and you see the curve. We don't see it here because the screen is hidden, but I see it now. And you see where I will go. And this isoball, the gray ones here, they shows you how deep is the anesthesia. The MAC 90, MAC 50, and MAC 08 here, the light gray. And actually here it's a deep anesthesia, and the anesthesia level on this point, I can show you, or this point, it's exactly the same. The only thing is the balance between opioid and hypnotic. And you can add as well any bolus you want during the case, like I can do here, and you see the effect directly on the screen, on the what-if function, and you can validate. And if something you just want to show and to see how it will act on the patient, even before pushing the drug inside the patient, you can delete it afterward and say, no, I don't want it anymore, and everything will comes back on the right. Is as well, could be as well a very good teaching tool as well. And last but not least, I have just 2 slides to show you to finish. The development of SmartPilot View, it's not a new software. Actually, we developed the first version in 2010. It was SmartPilot View 1. And we did some improvement in 2015 with SmartPilot View 2, with some data coming from syringe pump, because we might have some syringes that are not connected to the SmartPilot View. You can manually add this rate, and it will be taken into account in the whole calculation of how deep is the anesthesia. And then we developed this year the SmartPilot View 3 with some course with the case transferred. If you have a SmartPilot View induction room and you want to continue in the operating room, you can open the case in the operating room and continue and finish the case after the total anesthesia. And last but not least, you will see it for those who will come to Arabelle's in Dubai. We developed the 3.1 version that will be integrated in the screen of the anesthesia machine directly, that it will be part of the anesthesia machine like when you have any mode, volume, pressure, whatever, inside the screen of the anesthesia machine. It will be on a Zeus IE from Draeger Medical. And there is CE mark, there is FDA mark. All of this was done already. And it's compatible with all the anesthesia machine, high-end anesthesia machine, Primus, Zeus, and Perseus. And as well, almost all the pumps existing in the market, and the monitor from Draeger if you want to display the monitoring parameter in the display. But it's not mandatory to have the hemodynamic on the display.
1 minute.
1 minute, okay. It's the last slide actually. For those who want to play with the device and see how it is, actually we develop an application in App Store. You just have to download it. It's free of charge. You can have it on an iPad, on iPhone, and you can simulate as I did just before with my own simulator in the computer, and you can see how it acts actually. That was it from my side. Thank you very much for your attention.